think it's class 3 is the answer, isn't it?
So it doesn't fit. So what we have.
So class 3 A&E is exactly the same as an urgent care clinic.
So what we are proposing doesn't fit into type 1, 2 and 3. So part of the reason why it's so hard to answer the questions is because, as you so rightly deduced, what the kinds of emergency care system for the future is changing because we are trying to get the right emergency care response to an individual's specific needs, which is why you have the argument as to why heart attacks should go to heart attack centres, stroke should go to stroke centres, trauma goes to trauma centres. And what Bruce Keogh was trying to do is say, all the different kinds of need in emergency care, this is the right medical and clinical response to that person.
I think without going too much into it, I think what we can see is it's currently, with the addition of some care for, such as Dr. Spicer described, it's currently closest to class 3 A&E, which is the same as an urgent care clinic, with some additions, mostly around areas that wouldn't typically be classed as an emergency, or it's certainly a blue light emergency.
So we're in danger of going around in circles here.
I think if everyone answered the questions, you would get a lot short point.
So if we could answer the question to give you a very clear answer, we would. But it's very hard in the absence of a national policy that we are waiting for to give you the answer.
Because we're going to reorganise our hospitals.
I think we've got the answer, which is it's not going to take blue light emergency ambulance cases.
It's not what it says.
So it will. So we've had the conversation before about blue light. The definition of blue light in the NHS means really sick. So there are very few blue light ambulances. There are lots of ambulance journeys for patients who are not in the very sick category, and we are expecting there to be ambulances.
We have been through that before. I want you to say yes, to agree it's not going to take blue light ambulance cases.
So
the question is.
So yes, it will not take blue light ambulances, but yes, it will take ambulances. In the same way that we have ambulances going to the Hammersmith Urgent Care Centre.
I think we all understand. In terms of having these changes go through now, when we are already in the election stage, which is important because ultimately you serve the people who not just vote for us, but pay for everyone's salaries in the public sector and services. Given this issue is going to be an issue of contention in the election where the people will be asked to make a democratic choice, one way or the other, and this will be at the heart, why would you want to have this dealt with and agreed prior to the election results, the interim business plan?
So the decision has already been made by the Secretary of State in 2013, and what we're now doing is writing the business case to implement the decision that he has already made.
So it's been, but he has no electoral mandate for that. So why not, given that this is a major point of contention, respect the democratic process and ask the new government, whoever that is, to make the decision on your plan? That would surely be more. Given that we've got one of our prisons, there hasn't been a lot of respect for the democratic process from anyone at Imperial or NHS in West London or the CCG, then we're saying that wouldn't it be better to have an electoral mandate behind your changes, given the level of controversy, rather than try and rush it through beforehand and jump whatever government coming into a position.
So I would say we are not rushing the delivery of the implementation business case. It is, everyone is putting a huge amount of energy and effort to do this well. I think it's up to the politicians to decide whether they want to approve it before the general election or not. It's not up to us. It's our task to deliver them a robust document which stands up to scrutiny, and we have committed to a timetable to do it in. That's our task, and then it's up to the politicians to decide, I think, when they wish to approve it or not.
So what we have as a situation here is a scenario where there is no electoral mandate for the changes that have happened in the NHS in recent years. It's something that's been put together without that. They're highly controversial, not least because there is no doubt that by misnaming A&Es as a class and mixing up exactly what they are, lives have been put at risk. There is no doubt that some of the more ridiculous positions taken by the former administration were rejected wholeheartedly by a public that was well aware of what was going on and felt misled by the former administration. And what you have now is an opportunity